I'm very happy to make some aging society in Japan and implications for the United States. And, maybe my old friend Glenn Fukushima might be surprised to have this kind of the topics, because I'm the very active on Japan-US trade issues. And lots of book on the Japan lobby and conflicts between two countries on the automobile, telecommunication, so on and so on for last 20 or 30 years. But I changed my topics because I became the member of the aging society now. Also, I received the Minister's Award from Ministry of the Internal Affairs and Communications on these issues, e-government and aging society. So one more thing, I came from Mount Fuji Prefecture, Yamanashi. So just showing the beautiful mountains.
So your house is somewhere around there? Yeah,
a small one over there. And now the ambassador of the Mount Fuji. It's not so difficult for me just explain the how beautiful the Mount Fuji for international tourism. So just showing a couple of the slides on the aging fact in G7. We don't have the G8 anymore, so G7 is right. But I prepared some time ago, but my forecast is right. So Japan is the top of the rising of the aging ratio among the total population. It's going on for many years. And maybe you don't know about the Waseda University's founder, Mr. Okuma Shigenobu. He mentioned a long time ago the Japanese people can live longer if the Japanese people can be a very healthy life, no drink, alcohol, no cigarette. People can live until 125 years old. He mentions the almost 100 years ago. So we are approaching that his message. And another one is Asia and the BRICS. Still, Japan is number one anyway in the world in terms of the ratio of the aging people or populations. So this is really interesting for everybody. And what is Japan now? If we say Japan number one, only aging. So just I changed my topic from Japan-US trade war to aging some time ago. So Japanese case from 1960 to projecting 2030, we call the super aging societies. And that is only Japan is defined as these categories among the 200 countries in the world. So just we can see the right side of the these tables projection for 2030s. Proportion of the elderly is almost 31.6%. It's almost 1/3 of the population is the aging people in Japan. It's amazing. And you can see any others, like life expectancy at birth. You know, women living 88, almost 89 years old, and the man is 82. And always many people ask me why the Japanese woman living longer than men for by 7 years, and I have no idea.
Lazy not to find.
Okay. So it's quite interesting. The many other figures on Japanese super aging societies, and we can have some issues, especially economics and social impact. For example, economic impacts, just we can say decline in growth potentials of the GDP growth, intensifying labor shortage. We have a lot of the aging peoples and very small number of the working peoples, and declining saving ratio. That's the so-called the economic impact. And social impact is increasingly heavy pressure on social security system. One is the pension system demand reform. Second is the forecasting increase in medical expenses. It's really important for increase of the consumption tax. Just a few days back, we started the new percentage of the consumption tax from 5 to 8%, just a few days back, right? April 1st. And 90%, more than 90% of the increase of the consumption tax is used for social securities. And I'm not sure, but similar problem might be in these countries in the future. And Korea and China, they are facing already the same problems. And European, maybe next few years, they have the same problems with Japan. And I tell you the interesting fact about the Japanese seniors, what they are in terms of the life. So I told you the 30% is including the handicapped people. And I was in United Nations yesterday in New York and discussed about these issues. Aging people plus handicapped people is almost 30% in Japan now. And 60% of the handicapped peoples are seniors, aging people in Japan. But aging peoples, our aging people is the 65 years and beyond, and Chinese aging people is 60 years and beyond. So there are some differences between Japan and China. But China has the almost 100 million aging peoples. So that's very serious now. And spend half of national health care cost. As I told you, the percent of the aging people in Japan is almost 1/4, but they are spending half of our health care cost. And 25% of the aging people live alone, and their percentage is expected to increase to almost 1/3. As I told you, the man die first, and then woman after 8 years in average. So we have many living alone people, and 70% of the person injured during the big disasters like Fukushima, East Japan, tsunami, and so on. Also some other earthquake in Japan. So aging people, 70% of injured people are aging people. You can just think about it. They cannot run out from the seaside to the mountains. It takes time. But younger people can run very quickly. Or there's aging people staying at the hospitals and no way to go out. Also, 80% of the aging people would like to die at home, not hospital. It's quite interesting. Japanese people want to die at home. That's our dream, according to our survey. And aging people keep half of the personal financial assets. That's important in terms of the economic growth. They are very rich in terms of financial assets, not cash flow of the income. And 80% of the retired people look for jobs, and 20% can get jobs. So we have to do something for this employment systems for senior people. And digital divide, and also total income is not so high. I told you, asset is very high. So this is a fact about Japanese seniors. And maybe in the United States you have very similar one in the future. And what we are doing at Waseda universities, you can see our global Silver ICT network. Silver is aging peoples, not only Japan, for global consensus. Silver. You can see a silver seat at the GR. So we are working with the OECD, and I'm the chair of the OECD ICCP committee on the Silver ICT project. I'm the also president of the APEC project on ICT application for the people with special need, aging and disabilities. And ITU, I'm the special envoy of the Secretary General of the United Nations. I'm the member of the expert group on the aging and e-participation. World Economic Forum, I'm member of the future agenda of the government, and especially aging societies. And WHO is a part of the United Nations in Geneva. I'm advising the aging issues. And China, we have the Japan-China forums, and also I have the Chinese expert on aging from the national government of China to my office, starting on the pension fund system. And ASEAN, we have the project with Singapore on aging issues using the ICT. And the CIO academies, I'm the president, and then we have the special task force. And UNESCO, I'm the chair of the disaster management, and I'm emphasizing the importance of the rescue issue on the aging in the crisis. And European Commission EU, we started the Japan-EU Forum on ICT for Aging Societies by Japanese government and the European Unions, and I'm the co-chair of this new forum. And what I'm looking for, and also I'm missing, is the US. That's why I came here. We need partner for global network of this very important agenda. Okay, so I hope I might have the very good partner in the United States. and work together to save the lives of the aging peoples and the aging societies. And this is 2 years ago, I organized the OECD APEC Waseda conference on silver ICT at Waseda University. We have the 400 experts from all over the world and talk about the new solutions for aging peoples and aging societies in 3 days. And we have some side event like a meeting with Waseda University Robot Center. It's very active and very high level of the innovations. And also, I asked the Shinjuku district, they have the senior women's group singing every weekend. And the center of the group, the main Shinjuku, you can see these ladies between 80 and 90 years old. They enjoy not watching, they enjoy playing the singing. Okay, so that's one of the ways in which we can make some community development with aging peoples in Tokyo. And our OECD APEC Waseda statement in September 4th of the 2012, after the conference, we talk about the PPP for silver economies and social entrepreneurship, PPP, public and private partnership, and the financing innovation for the aging societies, the ICT applications, also age-friendly cities network, we call smart cities, not for energy saving, but also age-friendly with the ICT. And also, we had a very good discussion about building resilient societies for emergency, like earthquake or tsunamis. And we discussed about the new role of the universities in aging societies. What the university can do for aging societies. And only 10 minutes?
Wow, you have to 10 to 15
Okay,
minutes.
50 minutes. Because I came from Tokyo, right? With the
Okay.
12 hours flight.
50 minutes, 50, right?
Well, just I rush on, so okay. And so remarks of the OECD APEC conference, we need standards, global standards for aging business and life framework and the platforms and interoperabilities. Also, the evaluations of traditional concepts and of the healthcare services, because we are introducing some ICT for healthcare. Also, we have the smart connectivities and excellent security systems. One of the reasons why the aging people do not use the ICT is, of course, one of the answers, the digital divide. But even they have the very good facilities of the ICT. They don't like the lack of the security system, cyber securities or information securities. So we need some issues on that. And collaborations, academia and government and industries. And we have the another conference, I told you, the Japan-EU Policy Forum on Silver ICT last December in Brussels. And from Japan, we had 20 experts, including NYC and the METI and Waseda, Tokyo University, and Toyota, NEC, KDDI, and some NGO. On the European side, they have the EC, and they have quite a number of the NGO which really take care of the aging societies. EC Alliance, ECH Alliance, all project, or Robot ERA, and so on. And we talk about the European Union's Horizon 2020. It's the huge financing project programs for until the 2020. So we may have some matching fund between Europe and Japan on aging issues. And APEC, as I said, I'm the chair of the ICT applications for people with special need, and we have the good meetings in Da Nang, Vietnam in 2012, and Tokyo, Hawaii, and Singapore is this year, is coming soon. And what we discuss is the ICT accessibilities and availabilities, affordabilities for aging peoples. Also, digital divide to digital opportunities and digital inclusions, and local, national, global linkage, and government initiatives to citizen-centric, ICT-driven, and using social media. Because social media is very important for aging people as well. And we need some e-government plus universal designs, because I'm the director of the APEC e-government research center. Okay? One of the issues is the silver e-democracies. Why is the Japanese politician is so keen to this issue? The answer is very clear. You know, almost 60% of the constituencies, not constituency, real voters at the election is the aging people. You know, young people do not go to voting place like a high school or so, but aging people is going there. So voting ratio is very high, more than 60%. So that's why the Japanese politics is now called the silver e-democracies. Maybe the United States, after 30 years, you have the same problems. You know, almost 2/3 of the voters are aging people. Okay? And we have the public service issues and social network issues and open data and big data on the consumption of the aging people. Every business wants to know how the behavior of the aging people for purchasing something. And also global standard, and so these are concerned with the silver e-democracies. And I told this terminology, silver e-democracies, in the UN conference in Geneva. And nobody understood. What is silver e-democracies? And I explained to them, and every expert is so surprised. And Ministry of International Affairs and Communication, MIC, Mr. Nakamizo talk about his functions. I'm the deputy chair of the Japan Council of Silver ICT, and we had already first stage and the major vision and proposals of the councils. And since we don't have enough time, so I printed out the report of our councils on the solution of aging societies by ICT. So you can get one of the papers. Yeah. So it's quite interesting how we can work with the aging societies with the very interesting solution. So, sorry, I can omit this part. You can get all of them. And if you have any questions, maybe you can raise later. Okay? Talking about the medical information collaborative infrastructures, life support business via GPS. So many different types of the ICT can be utilized for solutions. Like improvement in ICT literature and achievement new work styles, telework. In the United States, telework is almost the normal activities for workers. But in Japan, still special cases. But we can introduce new work styles, like telework in Japan, as the engine for women's inclusions in our societies as a very important contribution to the economic societies. Also, we need the robot for practical use. And we have so many different types of the robot now in Japan. Communication robot or supportive robot or so on and so on. And this is one of the very important topics between Japan and the United States to make the joint collaborations. And we are now creating a silver ICT industry. And I'll tell you why later. And also international cooperation, which I'm now doing on behalf of Japan. And entertainment, Asian people enjoy the summer games or so on. Also, we have the some new innovations for assisting hearings or visualize the broadcasting. And even simple phones. Anybody from Fujitsu now?
Not today.
Oh, you
sorry.
Fujitsu. So Fujitsu has the lap phone for not only for aging people, but mainly aging. We are very pleased to have this. A very simple phone. And this type of the robot, assisting robot for well-being, and so-called the successful offerings for monitoring of the aging people, and their family can monitor in remote areas. And also, my spoon is a robot is cooking. So many different things. And maybe you can enjoy later on these innovative activities. And next is the disaster issues, and I told you the many victims, aging peoples. This is increasing disaster-related refugees, mainly aging people. And I show this picture at the conference in the United Nations. And I told the audience that I don't know how many people there, but they have no house, and they moved to some big gymnasiums of the high school. So the difference between the Japanese pupils together in this type of the refugee type livings for maybe I don't know how many days, maybe 1 week or 1 month. They have no troubles among them. They are disciplined, very quiet, and people in India and Pakistan. Why Japanese people so silent in the evening? Why they don't make a conflict among the peoples? That's our cultural issues. Very, very cooperative. And I'm the chair of the UNESCO's on disaster management, and as I told, 70% of India's victims are the elderly peoples. So many disasters, including World Trade Center. And Otsuki City project is our operational test bed, and Professor Iwasaki in charge for this Mount Fuji city, and she explained 3 minutes, and you can understand the real work of the Waseda's effort for promoting new societies.
I'd like to introduce the Otsuki project, the Mount Fuji project. So this is an MIC and the Ministry of Internal Affairs and Communications Missions. So we'd like to create the Japan models, and so this is one of the case studies. And so there are a lot of areas which suffered from the less populated and high ratio of aging peoples. So as Professor mentioned, the aging issues will be serious not only Japan but also worldwide. So therefore, we try to solve these issues by utilizing the ICT and cooperate with the Otsuki City near the Mount Fuji. And so this is the budget of MICs. So our goal is to promote an inclusive and empowered communities and silver aging societies in local areas by utilizing the ICT applications. And we focus on 3 points. One is e-agriculture, and the second one is e-health, and the third one is e-tourism. And by utilizing the sensor network, people can monitor it in the field. So the role of the sensor network and the new technologies. As new technologies, means the smartphones and the mobile phones and so on. And according to our surveys, and 80% of aging people want to work. However, only 20% can get jobs. So therefore, we aim to expand the opportunity to work for aging peoples. And the revitalizations of the economies by increasing the elderly people's job opportunities. And as for the e-health, before and after this project, we monitor the health of the aging. So we try to manage and support aging peoples and health enhancement of the aging people by working. And as for the tourism, the issues of super aging society is not for only aging peoples. So we need to think about other societies. So therefore, we need to design and create the aging societies, incorporate with, for example, the young generations or women. So the convergence between young generations and aging generation will be a very important things for us. And multi-generation harmonization by participations. So Waseda University evaluated this project from the several aspects, and we created new models of this project. And so this project was finished this month, so just finished. So this project was successfully, almost successfully finished. So in the future, I'd like to report the benchmark or the monitoring systems of this project.
So we have the real test bed in the Mount Fuji areas by Waseda University. And this is the Yamanashi prefectures and the Otsuki cities in this Yamanashi prefectures. And we have the super highways, super information highways in these areas. And this is what we can make the innovative collaborations between Japan and the United States. Several of the silver ICT applications. We have so many different type of the ICT applications, not only robot but also telemedicine or so on and so on. And this is mobile issues for telemedicine healthcare for aging communities. And also we have the sensor system, ubiquitous sensor systems for community-based technologies, and elderly RFID to find out the location of the aging people walking around. And this is almost the last of the slide. And, we are making really comprehensive research, starting from social participations and pensions and housing and employment and traffic, mobility, so on. So aging society issues is not single one. It is cross-cutting of so many different sectors. So I hope you may have one of the expertise on the solutions and applications. And we calculated how big the business market for silver peoples. And this is our estimate. What we say, 197.8 billion US dollars, 2012. And the major expense of the aging people is the e-health and medical ICT equipment. And of course, they have some others like security, safety issues. It's a huge market right now, and more bigger market in the future. So this is really economic issues, and also one of the biggest global market in the world is the senior market. So conclusion is the best practice on innovations, and we can give any other issues on the best practice. And this is my book called The Aging Society and the ICT, written by myself and Professor Iwasaki and Professor Offred of the George Mason Universities, by iOS Press in Amsterdam. So I cannot give you this, but you can check the website. And also we have the new field of research is social inclusions. And also how we can create a new job for aging people. Also PPP, public and private partnership project, and a comprehensive approach which I showed the matrix, and the pilot project like Otsuki project. And we need the really resident community development, and also evaluation of the return on ICT investment on these new communities. And just you can see, silver ICT market will be a single biggest sector and estimate 10 trillion US dollars in 2035. So it's quite an important market for future. Also, user-driven innovation is needed, and the usability and accessibility of the ICT application will be the key factor for citizen-centric societies. And preventive medicines will be reduce total medical expenses and encourage the promotion of the good health. And need for joint innovation in R&D between Japan and the United States. Thank you very much, and I hope Mr. Imamura is okay for this 15 minutes over the time.
$10 per minute. Well, thank you very much.
Yeah, thank you very much.
Majid will going to make some short presentation about your organization, and then some comments on Dr. Obi's presentation.
Thank you. Thank you, Yuki. Mr. Imamura asked me to react and give some comments. But before doing that, I would like to give you an idea about the leading age and caste, what we are and what we do, and then respond or react to the suggestions, the excellent suggestions that Dr. Obi just presented. Any one of you heard of CAST or Leading Age before? That's what I thought, maybe a couple of people. So CAST is a program of Leading Age, and Leading Age is a not-for-profit 501c3 organization that has under its umbrella over 6,000 aging service provider organizations that serve over 4 million elderly people on a daily basis in different settings, in continuing care retirement communities, skilled nursing facilities, all the way to home and community-based services. The only common factor is that they're all not-for-profit. And CAST is a unique program within this organization. It's a Center for Aging Services Technologies. It's unique because it opens and brings in academic researchers who are either developing or evaluating technologies for aging services and the older adult population, as well as technology companies who are developing solutions for this population. We have 4 focus areas. The first one is research, different types of research to just catalog and raise awareness to available technologies, as well as hands-on research to evaluation projects in real-life settings, in partnership with aging service provider organizations, and as well as, of course, research helping connect technology companies with aging service provider organizations to foster a user-centered design approach to ensure that the technologies being developed for this population and for this service sector end up being used and adopted and utilized effectively. So we also do a lot of advocacy and policy research. We identify barriers to the development and adoption of these technologies and advocate to remove those barriers. We recognize, and I saw that Dr. Obi focused on standards. We recognize the importance of standards from inception, and we focus primarily on interoperability standards for electronic health records to ensure that we take into account the unique requirements for the aging service providers, the nursing homes, the rehab facilities, and so on and so forth. And we've made several successes here with our advocacy in HL7 and with our work with the Office of the National Coordinator for Health IT in the US. Finally, our goal is to increase awareness and educate primarily aging service providers as well as consumers about the availability of the technology and the potential of technology. In 2011, after the passage of the Affordable Care Act here in the U.S., the health reform, we saw that the payment models are changing significantly, and we recognize the important role technology could play as a key enabler. So we created a video. They say a picture is worth 1,000 words. So we wanted to sort of make it easier for people to capture the value of technology. And we did this video that I'm going to play for you. It's a short video, two minutes. There's a longer 9-minute version of it on our website as well, demonstrating the value of technology and the value of technology-enabled long-term and post-acute care providers in the overall healthcare ecosystem. So let's see. I do apologize, this sound, we could not get a line into the computer. Can you hear anything? You can't hear anything, right?
We asked them to access to this
Yeah.
your website.
Yeah, it's available on our website. So what it's in essence, what it shows technologies that are available today on the market. There's no smoking mirrors, no technologies that are still in the conceptual design. All of these technologies featured from personal health records, to interoperable electronic health records, to personal emergency response systems that automatically detect the falls, to bed monitors that monitor sleep and can detect arising health issues early, to motion sensors strategically placed in the home to detect activities of daily living and detect changes from normal behavioral patterns that are indicative, that could be behavioral indicators of decline of health, all the way to technologies being used in rehabilitation or assistive technologies, right? So that was done again to help our members strategically think about integrating these kinds of solutions into their business models. And again, the three key enabling technologies that we identified in our strategic planning work were primarily interoperable electronic health records that are capable of exchanging health information meaningfully with acute care partners, hospitals namely, and primary care physicians. Telemonitoring in general, but more specifically, biometric remote patient monitoring that can help in the management of chronic conditions. And finally, care coordination tools that allow the shared planning of care and the follow-up on the execution of the shared care plan. So also back in 2012, we've done a report to Congress that was a study that was mandated in the HITECH Act. And I was the co-director of that study. We looked at 8 care issues that affect older adults as well as individuals with disabilities, from falls to immobility to cognitive impairments, functional decline, chronic conditions, and so on and so forth. We looked at the size of the issue, the number of people impacted by it, the cost, the burden on informal caregivers, as well as available technology solutions that can help in preventing or treating these kinds of conditions. And we also looked at the experience of other countries. So Japan, and especially Scandinavia as well, and the European Union, we looked at promising projects and promising technologies from those countries, and we looked at the evidence of efficacy and cost effectiveness for these solutions, identified the barriers, and provided some suggestions, as the Department of Health and Human Services preferred, the word they preferred us to use, to remove those barriers. And generally, the adoption barriers boil down to lack of awareness, not only among the older adults and the lay caregivers or the family caregivers, but more importantly by the professional caregivers who should be referring older adults to using these kinds of solutions, like hospital discharge planners, physicians, nurses, and so on and so forth. There is variability of evidence of value, evidence of efficacy and cost effectiveness. Most of the technologies we looked at, there is sufficient evidence of efficacy, a weaker evidence of cost effectiveness. But again, the cost effectiveness is primarily because these were not utilized in the right business model. And there is a lot of disincentives in prevailing reimbursement structures here in the US. For example, remote patient monitoring is one of the most successfully utilized technology for chronic disease management, and the VA, the Veterans Administration, is a leading user of that technology, but they're a unique care provider. They're the provider as well as the payer. So that doesn't exist, and Medicare, in many cases, does not reimburse for home telehealth, for example. So generally speaking, the evidence of cost effectiveness is a little bit weaker, and from my perspective, I think in order to prove the cost effectiveness, we really need to engage the payers right from the conception stage of designing these pilots and these demonstration projects. The other things that we're doing to help providers plan for, adopt, and appropriately utilize these technologies, we started doing hands-on tools. So we started with the electronic health records. We did a white paper that walks providers through the most important planning steps they need to be considering. And we went out and did a scanning of the environment. We looked at, last year we looked at 36 EHRs that were designed for long-term and post-acute care. We compared them again across over 275 functionalities and features to raise awareness among the provider community about existing products and to help them do the selection. We also created a simplified online selection tool and asked providers to submit case studies demonstrating the value, the return on investment, and the impact on quality of care. Last year, I was crazy enough not only to update the 2012 EHR initiative, but to also launch a similar project with respect to telehealth and remote patient monitoring. Last year, we compared 22 products from 16 vendors across, again, over 250 functionalities and features, and we have a functioning online tool. This year, we're updating both initiatives, and we're launching, because less than 50% of of patients in the US take their medications as prescribed. We're focusing a lot of attention on medication management, and we're launching a similar initiative that is currently underway to do the same: white paper, selection matrix, online selection tool, and a set of case studies. We're also, these tools are at the sort of operational level, but we feel, and the video is right there at the top strategic level, and we feel that there is a gap that we need to educate care providers about the importance and how to conduct proper IT strategic planning to prepare their information and communications infrastructure, to tie their strategic goals from their organizational strategic planning to potential technology applications, and go systematically through that process, prepare their infrastructure, and then start deploying or start implementing those technology applications that they've identified. This is something that we're going to be working on next year, towards the end of this year and the beginning of 2015. Again, I definitely agree on the need for interoperability. We put a lot of emphasis on interoperability standards and health information exchange capabilities in our and certification of interoperability in our both our telehealth as well as EHR work. We see a need for critical reevaluation of traditional health care services. I believe we don't pay enough attention to social determinants of health. And again, we're focusing on health because healthcare spending is a major issue here in the US, and we see it as a foot in the door to start doing more and more on the social supportive efforts. I believe we need to start with cost-effective evaluation of proven technologies that are ready for prime time. I hate the word pilots. We've done enough pilots, and if we get stuck in that pilot mode, we will never get out of it. I would like to see a large-scale demonstration, personally coming out of CMS, CMMI, the Center for Medicare and Medicaid Innovation, in partnership with private insurance, employee benefit programs, and so on and so forth, and of course with providers supported by technology companies. And I see a lot of potential there for collaboration with Japan, with technology companies that have proven technologies in Japan to bring it over to the US market. Also looking at some of the successful models. I'm very intrigued by the city project, especially the e-health project. I would love to connect with you and learn a little bit more and see how we can work together. We also need to, once we've done the successful demonstrations, we need to find effective ways to drive the adoption through innovative dissemination. Academic journal papers are great for academicians, but they rarely or take too long to impact practice. So we need to find ways to awareness campaigns, to convince the consumers, to sort of push them the same way the pharmaceutical industry started pushing people to ask their doctors about Viagra and other kinds of interventions, right? And then change, of course, policies and practices. We should continue to encourage grounding the user-centered technology developments in partnership with providers and users. Again, I think we look, personally, I see the development pipeline with the technologies that are ready for adoption at the end, and we need to do something to keep the innovation flowing, but we should not invest in efforts upstream in new products and new ideas and innovative solutions. And this is why we encourage, as I said, the user-centered design approach. Last year we launched what we called the Engage with Age Hackfest. We brought multidisciplinary teams of students from universities. They had to have someone with a background in healthcare or social services, like a gerontologist or a nurse or a physician, as well as a business specialist who understands marketing and business aspects, as well as at least 2 developers, front-end developer and back-end developer. And we not lock them, but put them in a room over 24 hours. And the unique aspect that we added, we brought in a coach from aging service provider to ground their innovations with realities of business and realities of regulatory environment, as well as an older adult as a potential user. And they work together on designing or hacking accelerated development of prototypes or applications and so on and so forth. So it was a true user-centered design approach at its best. And again, what we do, we have an annual conference, and we did the hackathon in conjunction with the annual conference. We also do an idea house. We built a regular size home, 5,000 square foot home on the show floor, and we invite technology companies to showcase their latest and greatest. In fact, I did invite, in 2010, I invited Cyberdyne to demonstrate how the hybrid assistive limb on the show floor. We had, a couple of years ago, we also had Paro, the robotic pet therapy seal from Japan. So I would encourage Japanese companies to work with us, and I'm happy to explore, as I said, the e-health project. I'm gonna stop here.
Well,
Thank
thank
you.
you very much.
Thank you.
Well, thank you very much. And then, we don't have much time, but I also wanted to set up maybe 15-20 minutes for discussion among ourselves. Any questions or comments or critique or proposal, we are very happy to have them. And well, 2 things I just wanted to say out of Dr. Omi's presentation. One is Japan now is enjoying, well, another type of Japan as a number 1, that is aging society. Second one is there is a missing link in his global network, which is the collaboration between Japan and the United States. Having said so, please raise your hand and make noise, and you can ask or question or make any comments as you wish. Please.
Yes, thank you for the wonderful presentations. So Washington D.C. has just, the mayor has just appointed a age-friendly city task force, and the president of the Urban Institute, the organization I'm from, is a member of that task force, so that's one reason why I'm here. But I'm wondering from some of the work you've done, particularly the Otsuki, thank you, demonstration, what lessons there are for cities about how to approach these issues.
Is that the question to Alan or?
Well, particularly in terms of the Otsuki model, I mean, is there a lesson for like city governments about what, municipal governments, about what they should do?
I think we can break that question to maybe a number of sub-questions, like what kinds of technologies were used, what kinds of supportive services delivered, what was the care delivery model, and if there was a business model, what was the business model, and what were the barriers and obstacles that you faced. and how you solve them. Does that?
Well, you can pick up any of that. You don't need to respond to all those questions. But
Yeah.
probably you might just pick up one.
Not only Otsuki models, but also our project with the MIC, the Otsuki City. We have just submitted the, 200 pages report to MIC and still embargo. I can tell you the models. And just we can wait 1 month, then I can give you our report, but in Japanese.
Well,
Maybe that might-
He has a month to learn Japanese, right?
Anyway, we can have the very good report after embargo of the MIC.
I understand that the Otsuki model is still being a kind of in practice, and then they are ready to give you more midterm report, including a benchmark and other indices which may take a look at. So probably better to wait a few more months or so.
What's the reason for an embargo? Why is there an embargo?
They're examining the report in the MIC, so we cannot explore before that. It's a Japanese bureaucracy.
It's a report to the sponsor. The sponsor needs to stamp it first.
But the Japanese government is trying to promote more the transparency, so they may be more transparent than before, but still maybe moving on so.
Okay, well, so I have 2 months to improve my Japanese.
All right. I just wonder which one comes first.
So I'm curious about how these innovations are produced and financed. In this country, we have the venture capital model, where maybe people who have investments are looking at promising new developments and seeding that, and maybe a few companies want to specialize in that. How is this done in Japan? Who are the leading companies, and what's the role of government?
There's so many different dimensions of the project. As I showed the matrix. If the transport, the Toyota might be. If the telemedicines, the Fujitsu or Panasonic, NEC, and anyway, so many different type of the sectors which we are talking about.
But it's usually the companies financing it themselves. rather
No, not only companies. I told you the PPP. The government also financing.
So this is a PP, which stands for public-private partnership. So that may be another new model to promote different types of the financing and development of technologies as well as business model. Probably, how about the entrepreneur types of companies? Are they aggressive in getting into this market?
Yes, special robot.
Robert?
Yeah, some innovations on the applications.
I have one basic question to Professor Obi. Have you ever studied and analyzed the impact of taking away the birthday retirement system from Japan?
Frankly speaking, that's not my type of research. No. All the research on aging societies is concerned with the ICT. Okay. So somebody else at Waseda University is very intensive in the, what's the name of the faculties, 人間科学部 in English, Kobayashi-san? There's so many professors there. Human science. The School of Human Science is dealing with the pensions or health. I'm dealing with the ICT-driven activities on aging society.
Okay.
Sorry, I was just
Sorry.
more of a comment than a question, but I know Nakamitsu-san and Dan can tell you a little bit more, but we just wrapped up our internet economy dialogue between the US and Japan. And the American Chamber of Commerce and Keidanren came out with a joint statement as part of that, identifying silver ICT as one area that they would like to cooperate on going forward. So it seems like there are some other people who are recognizing perhaps this missing US-Japan link. So that's just on the private side.
Yes, when we organized the Japan-Europeans Forum on Aging Societies with ICT, Keidanren sent 5 staff and the 3 CEOs. So Keidanren is really interested in the aging societies. Maybe you found some discussion with Keidanren and MIC on the internet dialogue.
Yeah.
You, sir.
Thank you. Very interesting, because when I was in grade school in early 1950s, Japan had 2 major demographic objectives. Live longer, because people are dying of tuberculosis and things like dysentery, young kids, little kids. So live longer from average age of 55, which is about the retirement age, which was established at that time. So they can live longer, and to have less babies because there were so many kids. And today, 60 years later, Japan achieved both objectives. We still have to figure out why women can live 6 years longer, living in the same country, eating the same food. What's the difference? It's not in the genetics, it's in lifestyle. And so if men want to live longer, they should imitate the way women live. That's one thing. But the other side is we have sort of ignored in your presentation. It's very interesting. You mentioned that the voters would end up being mostly old people, and that young people and young mothers too very often have neither the votes nor the time to vote, meaning that the budget can be skewed to prolong life rather than support young people from entering society. And the government keeps on saying we should have more kids to finance, let's say, pensions and Medicare. And I don't think that young women would want to have babies so that they can work to provide pensions, you know. So that's the dilemma Japan faces. And also we have to remember that old people are not all generous or, let's say, society-minded. They could be very selfish. Therefore, they could, again, take an inordinate portion of the budget to prevent death rather than enjoy life. I think in your paper, you may have addressed this issue, the difference between just staying alive and enjoying life, like the ladies who were singing. So I think it's very important to address that. Words that Japan has, like netakiri, rojin, and also the other important term, kodokushi. People, in fact, Japan has one of the highest rates of old people suicides, mainly, I think, because they are society and public-minded. They feel that they could not justify wasting society's money. This is another, I say, good cultural traits of Japanese. So sorry for the long comment, but.
Yeah, I had a question about the, actually related to previous questions. Do you know how much the government funds ICT research? What's the ICT research budget, or silver ICT research budget from the government?
No, actually, I don't know.
Okay,
Yeah, each ministry has some fund.
right.
Nobody can accumulate its own funds,
Yeah.
the amount.
What else? Yes, please.
I don't know if it's still embargoed, but I'm just quite with this presentation. Could you elaborate? Maybe I missed it, but there were three things: agriculture, health, and tourism. Could you elaborate just a little bit about agriculture? You said older people are having hard time trying to find work. How does ICT help
Job seekers.
in agriculture? Change a little bit about them.
Aging society, agriculture, and ICT, right?
Right.
These
How
are
do
the
they
keys.
connect?
Agriculture means so we use the sensor and monitoring systems, and so we can monitor the field by using the sensors. But then, for example, the aging people cannot work full-time work, so they can monitor the field and every day and by watching the PCs. Depends on the climate change and temperatures and
So that
so
maybe
they
we can
can
have something better. Just make it more effective to time of change. Or save the energy.
Could you use the microphone?
So before and after the activities of the agriculture, and we can monitor the health and the aging peoples.
You know, traditionally in Japan, agriculture is really kind of declining in terms of the population, in terms of the income generation, and so on and so forth. So the aged people are being remain in agriculture while the young people are going out in urban areas. So we call it the Sanchan Nogyo, 3 chans agriculture, which means To-chan, Ka-chan, what else? Ji-chan, Ba-chan. Or grandma, grandpa, and or mother, father, which means all generations or all population has been primarily engaged in agriculture. So that area could be revitalized by using ICT. Anything else? Yes.
Well,
So once you raise your hand.
Okay. So, since Dr. Obi mentioned that he is focused on ICT technology, and this is something related to what Dr. Owen mentioned. So in Japan, in terms of using electronic health record, is there any form of movement towards standardization for that? Because I heard that there's a fragmentation among each hospital making their own electronic records in Japan, and there's not much of interoperability between technology and data.
Yes, and I give you some record of the MIC activities which I'm the deputy chair, and you can find out the nationwide hospital network. It was the nationwide worldwide expansion of medical information collaborative infrastructure. This is one of the very interesting big projects. It's a very big project to connect all the hospitals in Japan on the so-called the health record.
So I thought it might be a good place to collaborate between US and Japan.
That's why I told you so I'm here. It's a very memorable day.
There should be someone from the Office of the National Coordinator though, right? They're overseeing the national infrastructure for health.
I don't want to.
Short one.
Short one. You might, Dr. Obi, visit some place like Grand Oaks, which is in the U.S. For old people, they have old care homes that is associated with major hospitals like City Hospital. In Japan, instead of doing that, they have now in Tokyo, I know many clinics, Zaitaku clinic, because as you indicated, 80% of old people would like to die in their homes, and which makes sense. So doctors and nurses make routine visits to homes. And then in the last phase, they have arrangements to take them to the hospital where they may die or they may die at home. And those two models might be comparable. And I think that's where US and Japan might collaborate.
If you wanted to study further with this matter, probably you would apply for the enrolling into his class from next step. Well, they are accepting even in September rather than April. So I don't know how much tuition is, but there'll be another way to study on this issue.
Almost time to over. And, I'm very happy to meet all of you here today and be in contact with Waseda University for further collaboration. Or even if there's any question you may raise by email or through Mr. Imamura. And I'm very happy to answer or make some initiatives to work with the United States. Thank you very much.
Well, thank you very much.